Hello, I'm Randhoni, Lairikyengbam, Assistant Director with SATI, a non-profit national organization headquartered in Chennai and formed in 2000, working towards universal access to rights, health, legal and social services for communities marginalized on account of HIV status and/or gender and sexuality through community support, information dissemination, networking, operational research, advocacy, training, and other technical assistance services. We work across the country through 12 offices. My leadership project is titled as Promoting Non-Discriminatory and Inclusive Health for Gender and Sexual Minorities. LGBTIQ communities in India and more so in the Northeast continue to face stigma and discrimination in many aspects, including health, education, justice, livelihood, and social protection. Around 4% of a given adult population is estimated to be LGBT in the United States, so is a probable estimate in India. The rates of depression, anxiety, and suicide are far greater in LGBT individuals. The rates of suicidal ideation and attempts among the transgender group are extremely high. This is a significant health gap through a true health inequity that is reversible. Despite some progresses made in laws and policies in India, such as the Supreme Court Nalsa judgment of 2014, recognizing the legal identity of transgender person, the Indian Psychiatric Society in their position statement in 2020, disapproving conversion therapy or any form of such treatment, the Transgender Persons Protection of Rights Act 2019 and Rules 2020 laid down significance on the transgender certificates and IDs that are to be issued by the district magistrates and suggested welfare measures. My project focuses on the disparities of health encountered by the LGBTQ communities, and many studies have proved that the lacunae are enormous. In one recent exploratory qualitative study conducted by a group of GIST professors in Mumbai and Delhi on understanding the discrimination against LGBTIQ patients in Indian hospitals using human rights perspective, it was found that most administrators and healthcare providers were not familiar with the varied needs of the LGBTIQ spectrum and treated them as a homogeneous group. The employees in core departments such as dermatology, psychiatry, and HIV services, which routinely cater to LGBTIQ patients, seem to be a little more sensitized than the other healthcare providers. Discrimination in public hospitals are explicit, while those in private and trust hospitals are subtle. Through the project, we envisaged to see increased number of LGBTIQ communities accessing healthcare, increased knowledge among frontline health workers, and friendly and stigma-free services from healthcare providers. We hope to achieve these through collaboration with the National Health Mission and state and district level ICPS and ICDS units of the Social Welfare Department, and of course with the support of community leaders and community-based organizations. Since July 2022, meetings with the officials had been conducted to carry out such trainings, and during July to December 2022, 6 such training programs were conducted in 3 districts of Manipur. Across the 3 districts, 44 healthcare providers, 141 frontline health workers, including 79 ASHAs and ANMs and 82 Anganwadi workers were trained on issues of gender and sexuality and need for inclusive care. Among the trained workers, 16 of them had been identified to provide further mentoring, and to also support them, 7 community leaders were identified from these districts. One-on-one mentoring sessions were conducted with few of them during the month of January 2023. It was also found that some of the trained frontline health workers were able to link gender non-conforming children to supportive services, and they were able to talk about gender and sexuality and gender non-conforming people to the local people in their areas of work. Another significant achievement during this period, during the fellowship period, was the inclusion of a gender marker column in the OPD ticket of a district hospital in Manipur, which is the Bishnupur district. These are some of the photographs of the trainings. Some of the challenges we would like to share are the training sessions were conducted solely on the dates given by the authorities, and it was very difficult to conduct trainings as and when we wanted. We also tried exploring incentives for from the NHM and the ICDS to be given to the frontline health workers who are able to provide support services for the LGBTIQ communities. The dialogue has begun with the authorities, but it seems that the criteria are very limited for incentivizing the frontline health workers, and they only can add to these during the next year of after they have a proper action planning and budgeting done. Another challenge that we come across is getting time and resources for the mentoring sessions. As so far we have found this a little bit challenging. Also, it was found that it's a kind of learning that we have found that in a district, it is always important to start sensitizing the chief of medical officer and his unit first before going to the grassroots level workers. The journey has really helped me explore my identity as a leader and how this can be nurtured to gear up for any assignment, both at work front and personal life. Inclusive and strategic leadership values were utilized during getting buy-in from stakeholders such as the National Health Mission and the Social Welfare Department. Building capacity for the workforce is critical to sustain the effort of our work. So focus now needs to strengthen and develop the capacity and knowledge of the frontline health workers and healthcare providers to ensure that the non-judgmental and non-discriminatory health services for the LGBTIQ communities is not a dream anymore. The learnings from the various sessions of the leadership journey and meaningful interactions had with our eminent mentors and coaches, and last but not the least, the wonderful interactions had with all our cohort members will go a very long way to better and strengthen our approaches towards sustaining the advocacy initiative. Many thanks to WomenLift Health for this wonderful opportunity. And also I would like to thank my senior officials, senior management at SATI for providing me this awesome platform. Thank you all so much.